Well, if you've been thinking about trying something different for those aches and pains, acupuncture may be exactly what you need. Here's Dr. Kohli. All right, Dr. Kohli, I want to get right to the point on this one because we're talking about acupuncture today.
Oh, I love it, Danny.
I stole it from our director, so thanks, class. So yeah, we are talking about acupuncture. This is something that a lot of people have started to incorporate into kind of their routines here. First of all, what are the benefits of acupuncture?
Yeah, so acupuncture, which is traditional sort of Chinese intervention, is using needles at very specific points around the body. They're called meridians to help our qi, which is our life force. It's our energy. And the idea here is to stimulate the nerves and the blood vessels and the connective tissue, the muscles and the bones and such, to really get that energy sort of reflowing. So the idea here is to put those at key points to treat a specific disease.
Okay.
So an acupuncturist will sort of design a plan for you. So no two acupuncture sessions may look the same, and it'll depend on what you're coming in for.
Sure.
So, you know, depending if you're talking about a GI illness like, you know, inflammatory bowel disease or irritable bowel syndrome, or you're talking about stress and anxiety, you're talking about fertility, depending on what it is you're trying to treat, it might look very different.
Even fertility, that's so interesting. Okay, so I mean, for me, I haven't tried this yet because I've always kind of been a little bit, you know, squeamish when it comes to needles, but are there risks to this? Are there reasons I should be worried?
You know, I'm glad you brought up the needles because now they're really using these sort of single time use disposable needles that you're supposed to throw away. So assuming that those are sterile and assuming you're pretty healthy, in other words, you're not on a blood thinner, you're not on any medications that would make you bleed, or, you know, you don't have neuropathies or other conditions like that, it's generally pretty safe to get acupuncture. Having said that, you want to be a little careful because, you know, the training can be very variable. And so you don't know one acupuncturist from the next. There's not really licenses or regulations that they have quite as much as physicians. And certainly if you place the needle too deep, you place it into a nerve, you place it too far into the muscle, you place it at the wrong point, close to your eyes and things like that, you can certainly cause potential harm. So you want to be careful, but for the most part, it's relatively safe and well tolerated.
Interesting. Okay. Well, I've had family members who've actually also done dry needling. Is there a difference between acupuncture and dry needling?
A huge difference. I mean, the theory is completely different, and the indications or why you do it is completely different. So remember, I said it's to restore your energy and your qi.
Yes.
That's acupuncture. Dry needling targets a specific muscle, and the idea there is to, you know, basically stimulate the muscle so that you get all the blood vessels to open up and get blood flow to that muscle. So it's kind of similar to what happens in massage. By pressing down on a muscle, you compress the blood vessels. Then when you let go, you cause them to sort of relax and the blood kind of flows in and brings healthy, you know, healing sort of chemicals with it. So that's the idea of dry needling, is using some kind of specific targeted stimulation. Sometimes they use electrical current, sometimes they just use the needle itself to really help heal any specific tissue damage that's occurred. Whereas acupuncture is more about kind of flow of energy and overall balance of your body.
Interesting. I want to bring this up with kids because I know a lot of people are starting to use things like acupuncture massage with their kids. Is this safe for our kids?
That's very interesting that you brought that up because just recently a bunch of data has emerged about using acupuncture in children to treat a variety of different things, including bedwetting, including anxiety, including behavioral disorders, you know, kids that are acting out and such. And as you said, a lot of kids are afraid of needles, right? And so they're actually thinking about using non-kind of traditional ways to do acupuncture. So cupping, where you're just kind of stimulating the blood flow through that. Stimulation in the ear, which is a type of acupuncture as well. And then just even kind of using your fingers to stimulate, you know, the pressure points and such in the body. So it's not necessarily using needles. Sometimes they'll use small electrical impulses as well that are not painful. They're just kind of a buzzing sensation on your skin. So these are things that have shown in kids to actually have benefit. Now, it should be a child older than 5 years of age. And I would really recommend you talk to your pediatrician because, again, these are sort of non-traditional paths. And so you want to go to somebody who works with kids, somebody who's recommended by your pediatrician, somebody that you trust your child with.
Interesting. Okay, I really like this method versus, you know, trying to force your kid to do something. It's just, it feels like it's a lot more natural in terms of kind of getting that energy back and regulated. Well, Dr. Kohli, thank you so much.
My pleasure, Danny.
Well, if you have a topic or question for Dr. Kohli, send us an email to mycoco@9news.com and put Kohli in the subject line. Your topic may just end up on the show.